Anticipation, which is nothing but identification. Recognition, which is nothing but acceptance. Evaluation, it is nothing but measurement and assessment. And control means control of workplace hazards or hazard or environmental stresses, which is nothing but heat, cold, or humidity, etc., damaging health of the workers or public. So basically, the industrial hygiene total topic deals with these four things. One is identification of environmental stresses. Then we are accepting it. Yes, there are certain factors which are impacting the people performance, which are creating the stress. Then we are going to evaluate. So to what extent they are creating a stress, to the what extent they are creating a discomfort, and also to the what extent they are reducing the efficiency of the workforce. అంటే ఏంటంటే ఫస్ట్ ఎన్విరాన్మెంటల్ అంటే వర్క్ ప్లేస్లో ఉన్న కండిషన్స్ని, అక్కడ ఉండే వాతావరణాన్ని కనిపెట్టడము. అంటే ఎటువంటి ఫ్యాక్టర్స్ అంటే ఎక్కువ టెంపరేచర్స్ ఉండము, లేదా ఎక్కువ చల్లగా ఉంటాము, డస్ట్ ఎక్కువ ఉంటాము, వాటిని కనిపెట్టడము. వాటిని కొన్నిటిని యాక్సెప్ట్ చేయటం. ఎస్, దెర్ ఆర్ ఫ్యూ థింగ్స్ ఆర్ దేర్ విచ్ ఆర్ creating the significant discomfort. Then based on that, we will take the control measures. We'll see in the following slides. So if you see in anticipation, it includes the prior knowledge of possible hazards and their effects on health. It includes all methods of identification of hazards. So basically, it is nothing but again a hazard identification technique. But here we talk about the environmental factors. So we talk about all possible health hazards and also the effects of health. Then recognition means acceptance of ill effects of the identified hazards and accepting that the environmental stresses endanger life, health, or accelerate aging process or causing discomfort. Evaluation means measuring or calculating the degree of the hazard. So I think this we can take it to the next. Evaluation means measuring or calculating the degree of the hazard, which means a quantitativeness or qualitative. So when you say quantitative, we'll have risk priority numbers. మనము ఏదైనా 3x3 మ్యాట్రిక్స్ కానీ 5x5 రిస్క్ మ్యాట్రిక్స్లో చూస్తాము. హజార్డ్ హైరార్కీ నెంబర్ గురించి, లేదంటే హజార్డ్ రిస్క్ నెంబర్ అని చెప్పేసి చెప్తూ ఉంటాము. సో టిల్ 3x3 అంటే రిస్క్ని ఎలా క్యాలిక్యులేట్ చేయొచ్చు? Probability into severity. So in one axis we'll have severity, in one axis you will have probability. So if you multiply these two, you will get the risk number, and also there you will get the going to quantify the risk by the instruments of, even here we can do air sampling also. If any fumes or the gases which are there in your atmosphere, there we can do an air sampling, and also we can analyze. Then comparison with the standards and taking judgment whether the measured or calculated hazard is more than or less than the permissible standards, and qualitative assessment. And also then we can do we can come to a conclusion that whether the identified or the analyzed results are within the limit or whether beyond the limit. So within the limit, in the sense we can say TLVs or PLVs, those are permissible exposure limits or threshold exposure limits, which are 8 hours of duration. So if we take an example of 5 ppm TLV, so for the entire 8 hours of duration, you can expose to the maximum of 5 ppm of chemical. So when we say ppm, parts per million, అంటే 1 lakh మాలిక్యూల్స్లో ఒక 5 మాలిక్యూల్స్ అనే వాటిని మనం 5 ppmగా కన్సిడర్ చేయొచ్చు. So control include engineering, administrative controls, and safe disposal of waste, medical examination, use of PPE, education, training, and supervision. So when we say control, you can correlate with the hazard hierarchy controls. There is no much difference with respect to the controls here. It is basically talks about the identified hazards, how it can be controlled by engineering, administrative, and also Sometimes the waste disposal also it leads to a severe health damage if you're not properly handling the waste. Then medical examinations. So medical examinations also they are very important. Until unless you are not doing any medical examination, you can't recognize the the level of exposure. That is also one thing. Then use of PPEs. So with the PPEs also we can avoid certain exposures whenever these engineering controls or other controls get failed. Then education and training. So we have to educate our workers and employees on the chemicals which are creating health issues. And also we have to train on our processes and procedures, and also we should have a strong supervision on the activities which we are performing. సో బేసిక్గా ఇక్కడ మనం ఏంటంటే కంట్రోల్స్లో ఐడెంటిఫై చేసిన హెల్త్ హజార్డ్ అంటే ఎన్విరాన్మెంటల్ ఫ్యాక్టర్స్ ద్వారా ఏదైతే ప్రమాదాలను గుర్తించామో వాటిని మనము వేరు పద్ధతుల ద్వారా మనం వాటిని కంట్రోల్ చేయొచ్చు. సో ఇంజనీరింగ్ కంట్రోల్స్ అంటే ఏం చెప్పొచ్చు, ఆటో కట్ ఆఫ్ కానీ, సెన్సర్స్ కానీ, తర్వాత ఎగ్జాస్ట్ సిస్టమ్స్. ఐ మీన్ వన్స్ any leakage happens, we'll have a sensor. The sensor immediately triggers the exhaust system. ఎప్పుడైతే మనము లీక్ డిటెక్షన్ సెన్సార్స్ పెడతామో ఇమీడియట్లీ ఆ సర్టైన్ పీపీఎంకి రాగానే అక్కడ మనకి ఈ సెన్సర్స్ అనేవి ఎగ్జాస్ట్ సిస్టమ్ని యాక్టివేట్ చేస్తాయి. ఎగ్జాస్ట్ సిస్టమ్ అంటే ఏంటి, అక్కడి నుంచి ఉన్న కెమికల్ మొత్తాన్ని సక్ చేసుకొని దెన్ ఇట్ విల్ టేక్ ఇట్ టు ది స్క్రబ్బర్స్. అక్కడి నుంచి అది స్క్రబ్బర్స్కి వెళ్తుంది. అక్కడ స్క్రబ్బర్స్లో మనం దాన్ని న్యూట్రలైజ్ చేస్తాం. దాంతోపాటుగా మెడికల్ ఎగ్జామినేషన్స్, పర్సనల్ ప్రొటెక్టివ్ ఎక్విప్మెంట్, హెల్మెట్స్ కానీ, పీపీఈస్, మేజర్లీ దీస్ ఫ్యాక్టర్స్ ఆర్ మోస్ట్లీ విత్ ఇన్హలేషన్ ప్రాబ్లమ్స్ ఆర్ సమ్టైమ్స్ ఫిజికల్ కంటామినేషన్ ఆల్సో. తర్వాత ట్రైనింగ్లు ఇచ్చుకోవటము, సూపర్విషన్. So when we say the scientific approach adapted in applying this industrial hygiene includes identifying the extent of toxicity, I mean the harmful effects of the chemicals and physical and biological agents, identifying the extent of employees exposure through inhalation, through the skin absorption or ingestion, and recommending and implementing process controls that reduce exposure to the harmful substances, and following safe work practices including use of personal protective equipment to guard against the exposures. So basically they have adopted the identifying the extent of toxicity. So how harmful effects, toxicity in the sense they also used to identifying the toxicity of the chemicals. Then physical and biological agents, when you say biohazard, so body fluids or some biological waste, that is also very important. Especially we can talk about hepatitis B or HIV. These all cross contaminated, it can easily spread to the this biological elements. Then identifying the extent of employees exposure. So this is also one thing, uh, to what extent the people are exposing. Okay, this is also very important. Okay, yeah. Okay, to the what extent the people are exposing, I mean how they are exposing, and to the what extent they are exposing. What extent means uh, how much quantity or duration or the amount of chemical they are inhaling or the amount of chemical they are exposing to. All these things will be come under the extent of exposure. So again, we'll see in the following slides that what is meant by inhalation, absorption, or ingestion, etc. Then they will implement the process controls. When we say process controls, mostly we prefer engineering controls like NRVs or SRVs, non-return valves, or pressure relief valves, or safety relief valves, and we'll have detection system, then exhaust ventilation systems, and also auto cutoff valves, etc., etc. These are not limited to. We'll have so many process controls, and also that reduce the exposure to the harmful substances. What will help? These process controls will help us on reduction of exposure. So how it will help? So once you have process controls in place, what will happen? It will not allow the chemicals to leak, so that your exposure will not be there at all. Then work practices including use of PPs and to guard the exposures. So apart from only the, not only the PPs will safeguard us, we should have solid procedures or process in place, so that we can effectively అవాయిడ్ ది ఎక్స్పోజర్. అంటే ఓన్లీ పీపీస్ మనల్ని ఎక్స్పోజర్ నుంచి కంట్రోల్ చేయలేవు. మన దగ్గర స్టాండర్డ్ ఆపరేటింగ్ ప్రొసీజర్స్ ఉండాలి ఇన్ కేస్ ఆఫ్ ఎనీ లీకేజ్ హ్యాపెన్స్. సో హౌ క్విక్లీ వీ కెన్ ఏబుల్ టు రిట్రైవ్, హౌ క్విక్లీ వీ కెన్ ఏబుల్ టు టేక్ కంట్రోల్ ఆన్ దట్ స్పిలేజ్. సమ్టైమ్స్ ఏమవుతుందంటే బ్యాగులు కానీ డ్రమ్స్ కానీ స్పాయిల్ అవ్వడం, లేదా డ్రమ్ హ్యాండిల్ చేసినప్పుడు కింద పడిపోయి ప్లాస్టిక్ డ్రమ్స్ పగిలిపోవటము. అంటే ఎంత క్విక్గా మనము ఆ కెమికల్ని మళ్ళీ అక్కడి నుంచి క్లీన్ చేయగలుగుతాం. సో కొన్ని కెమికల్స్ అండి కింద పడిపోగానే ఫ్యూమ్స్ జనరేట్ చేస్తూ ఉంటాయి. సో ద మోర్ టైమ్ యూ విల్ లీవ్ ద కెమికల్ ఆన్ ద ఫ్లోర్, ద మోర్ ద ఫ్యూమ్స్ ఇట్ విల్ జనరేట్. అంటే హౌ క్విక్లీ యూ కెన్ టేక్ అవుట్ దట్ కంటామినెంట్ ఫ్రమ్ ది అట్మాస్ఫియర్. అట్మాస్ఫియర్ అంటే ఫ్లోర్ అవ్వచ్చు, దట్ ఈస్ నథింగ్ బట్ ఆన్ ద ఫ్లోర్ ఆర్ వేర్ ఎవర్ యువర్ ద స్పిల్ has happened. Okay. Now we'll see the health effects are unlikely to occur unless exposure occurs. So basically, until unless you're not exposed to that chemical, you will not have any health effects. That is true. Okay. You're not having health effects, you are not having exposure, definitely you will not have health exposures. That is a simple logic. The science of qualitative and quantitative exposure assessment is applied in the determining the extent of exposure. These data then are used in determining the need for implementing prevention and control measures. So, based on the scientific quantifications or qualitative exposures, they will define what type of controls to be implemented for this process. That's why for any chemical process to be taken, they will have a pilot plant. Once the pilot plant is successful, then they will go for scaling up of their production. Then it will come to the production. Now we'll see the difference between industrial hygiene and occupational health. What is differing from these two? So basically, this industrial hygiene deals with the control techniques to reduce or eliminate the ill effects of environmental hazards like chemical, physical, biological, and economic hazards on human health. The control techniques are mostly engineering control measures, which try to measure, quantify, monitor, control, and eliminate. So one is to try to measure the exposures, and then they quantify it, then they monitor and their control, then try to eliminate that exposure. So if you see some of the hazards like chemical hazards like dust, gas, fumes, or acids or solvents, etc., and physical hazards like high temperatures, exposure to the pressure lines, or noise, vibration, and radiation, and biological hazards like bacteria, virus, fungus, insects, molds, parasites, algae, protozoans, etc., and even food contamination, drinking water, cleanliness, waste and sewage disposal also will have biological hazards. Then ergonomic hazards that we are well aware, like pain or illness, accident due to the wrong design, awkward position, improper lifting, then man mission or non alignment. So man mission alignment, they are man and mission, they are not aligned, or they are not synced with, or a person is not able to meet the requirement, or the machine is not designed to the human factors. And application of engineering and biomechanical principles can eliminate such hazards. Okay, that is about the list of hazards. When we say occupational health, the more the effects and the consequences of environmental hazards or stresses like chemical, physical, biological, and economic on human health, the techniques are mostly a medical or study. So here it talks about ill effects or diseases on health, a bodily disorder or a maladjustment, medical remedies to remove the occupational illness or disease, preventive measures to avoid the diseases or maintaining good health, and improvement of nutrition and the general physical mental health of the workers. So basically, occupational health studies on ill effects or diseases on the health, but industrial hygiene talks about the environmental factors, how to identify, how to measure, how to analyze, and how to control. But occupational health is completely different. It talks about ill effects and disease. Once a person is exposed, or once a person is got sick, from there these occupational health studies will take a call. Okay. So when we say industrial hygiene attempts to eliminate or minimize the exposure of environmental or work hazards on human or public health by engineering controls or good housekeeping, and keeps the workplace environment clean, pollution free, and also hygienic, while occupational health deals with the effects of exposure that pertains human health, gives medicines to improve it, and also by pre-employment and periodical medical examinations, it strives to anticipate early detection of occupational diseases, and also tries for continuous health care of the workers. It is simple that ఇండస్ట్రియల్ హైజీన్ ఏంటంటే వర్క్ అంటే పని ప్రదేశాల్లో ఉండే ప్రమాదాలు, సో ఫిజికల్ కానీ కెమికల్ కానీ బయలాజికల్ ఏజెంట్స్ ద్వారా జరిగే ప్రమాదాల గురించి మాట్లాడుతుంది. సో ఆక్యుపేషనల్ హెల్త్ ఏంటంటే దాని తర్వాత వచ్చే ఎక్స్పోజర్స్ గురించి మాట్లాడుతుంది ప్రీ ఎంప్లాయ్మెంట్లో. సో ఏదైతే మనము కంపెనీలో జాయిన్ అయినప్పుడు డెఫినెట్లీ ఎవ్రీ ఆర్గనైజేషన్ విల్ ఆస్క్ అస్ టు గో త్రూ ద ప్రీ ఎంప్లాయ్మెంట్ మెడికల్ ఎగ్జామినేషన్, బికాస్ in our factories act there is a schedule called schedule 3 occupational diseases. I have taken this example many times. In the schedule 3, there it talks about the occupational ill health, or there I think now it is 31 occupational diseases are identified. If you are exposed, or if you are a victim of those occupational ill health or occupational disease, so the occupier has to give you a compensation. That is again a different story and different topic. So that is the why always a management used to do or conduct pre-employment medical examination to see the condition of the employee. Otherwise, he would have had the exposure. We'll take an example of high noise. So he's a maintenance technician. He's already having a deafness. He is not able to uh, listen certain noises. He exposed in high noises in his old company. Unfortunately, next company they are not done such examination. He can come and claim his noise induced hearing effect. That is one of the occupational disease, noise induced hearing effect. అంటే పెద్ద పెద్ద శబ్దాలకు తను గురవడం వల్ల హీస్ లాస్ట్ హిస్ హియరింగ్ ఎబిలిటీ అంటే తను వినికిడి శక్తిని కోల్పోవడం, హీ లాస్ట్ హిస్ హియరింగ్ ఎబిలిటీ. సో దాన్ని ఇక్కడికి వచ్చి క్లెయిమ్ చేస్తే దిస్ ఎంప్లాయర్ ఈస్ గోయింగ్ టు లాస్ దట్ కాంపెన్సేషన్ అమౌంట్. దట్స్ వై every organization they prefer to have pre-employment medical examination. Okay, yes. Then occupational health, also known as occupational medicine, aims at identifying occupational diseases, as I mentioned, in the early stages. When we say early stages, the best example is pre-employment medical examinations and also intermediate examinations. So, industrial hygiene is aimed to identifying and rectifying the causes leading to occupational disease. So, here occupational health is talking about early identification of occupational disease, but industrial hygiene is talking about how they can prevent and rectify the things to avoid the occupational disease. అంటే ఇండస్ట్రియల్ హైజీన్ ఏమో రాకుండా ఆపుతుంది, ఆక్యుపేషనల్ హెల్త్ ఏమో వచ్చిన తర్వాత ఏం చేయాలో చూస్తుంది, అంటే ఎర్లీ ఐడెంటిఫికేషన్ కూడా చేస్తుంది. Like prevention is better than cure. So industrial hygiene is always trying to prevent these occupation or prevent the causes which can create occupational diseases. Then occupational health talks about the early identification of those diseases. If somebody is exposed, then they try to identify and they will take the further measures. By the time of occupational disease is identified, it may be too late. Therefore, prevention and control of factors leading to occupational illness and disease is the best option. Ultimately, it increases the lifespan. So, basically, sometimes what will happen, it may got delayed. So, if you take an example of a cancer, so doctor used to say, we used to see in many movies. So, it is a fourth stage. You would have ఐడెంటిఫైడ్ ఇన్ ఎర్లీ స్టేజెస్ వీ వుడ్ హావ్ సేవ్డ్ హిమ్. సో కొంచెం ముందు తీసుకొచ్చుంటే మేము బతికించే వాళ్ళము, లేదంటే ఇంకేమైనా చేసేవాళ్ళని చెప్తూ ఉంటారు. సో సమ్ టైమ్స్ ఇట్ బికమ్ లేట్ ఫర్ ది ఐడెంటిఫికేషన్ ఆఫ్ దిస్ occupational disease. Therefore, prevention and control of factors leading to occupational ill health and disease is the best option. That means it is always to follow the industrial hygiene practices. So, when we say industrial hygiene practices, so anticipation, then recognition, then examination or measurement or evaluation, then control. So, before the people are exposing to the chemicals, we should always implement the controls, or we always try to control the causes of క్రియేటింగ్ సచ్ ఇల్నెస్. అంటే ఏంటంటే మనుషులు ఆ ఎక్స్పోజర్కి, కెమికల్ ఎక్స్పోజర్కి గురవకుండా ఎలా ఉండగలగాలి, ఆర్ ఏం చేయాలన్న దాని గురించి మనం ఎక్కువ ఫోకస్ చేయాలి. అంటే కెమికల్ స్పిల్లేజెస్ కానీ, ఎక్స్పోజర్స్ కానీ, లీకేజెస్ కానీ, వీటన్నింటిని మనము ఎఫెక్టివ్గా కంట్రోల్ చేయటం వల్ల ఎవరు దీనికి ఎక్స్పోజ్ అవ్వకుండా ఉంటారు. ఓకే, even if, so ultimately it increases the lifespan. So what will happen if the people are not exposing to the chemical hazards? What will happen? Definitely your lifespan will increase. Simple example, if you are addicted to the tobacco, if you are addicted to some tobacco, etc., or if you are an alcoholic addict, comparing with others, your lifespan will be better. Maybe nowadays the passive smokers, which means who are not directly uh, smoking, doing smoking, who are inhaling the smoke which is exhaled by the smokers, they are getting more exposed to such illnesses. Those we called as passive smokers. అంటే తాగే వాళ్ళకన్నా కూడాను ఆ తాగి వదిలిన పొగ పీల్చి ఎక్కువ మంది ఈ హెల్త్ ఇష్యూస్కి గురవుతున్నారు. So, if no occupational disease has occurred, the hazard at the workplace reduce the lives of exposed people from few days to a few years. Therefore, industrial hygiene practice is always useful and also most desired to assess and make the workplace safe and to stop decreasing the precious lifespan. So if there is no occupational disease has occurred, the hazards at the workplace reduce the lifespan. So what will happen? Basically, if you are exposing, your lifespan will automatically reduce, sometimes from the days, or sometimes it may go down to the years also. Maybe your nowadays in India, the general lifespan is 60 to 70 years. If you're exposing, or if you're having bad habits or bad eating habits or bad personal hygiene habits, so your lifespan may come down to 30, 40 years also. Even if we have seen, uh, the IT, the tech staff are getting heart attacks at the early stages because of even work stress also, even unhealthy eating habits. So having so much of junk food and fast food or processed food can leads to a bad cholesterol or etc, which is reducing their lifespan from 60 years to 25 or 24 years. So therefore, the industrial hygiene practice is always useful, most desired to assess and make workplace safe and also stop decreasing the precious life. So we have to have a better implement these controls to avoid the reducing our precious lifespan. Okay. Then difference with public health. So how industrial hygiene is differing from the public health? Occupational health deal with a man in relation to his work and the working environment inside the workplace. So basically, when we say occupational health, there are two words. One is occupation and other word is health. When we say occupation, the activity or the job you are doing. So the simple example is welding is an occupation, painting is an occupation, a mission operator is an occupation, or an office boy, that is his occupation. So it deals with basically relation to his work. So if the welding, what will happen? If the people are exposing to the welding fumes, so you may get sidrosis because of inhalation of metal fumes. It leads to sidrosis. It is one of the disease actually. Okay, even who is working in the cotton mills, they'll have bicinosis, who is exposing to the cotton dust. Even asbestosis, that is also one of the occupational health disease. Okay, occupational health always deals with in relation to his work or her work. So whoever is working on specific activity, and then the working environment inside the workplace, and both physically and mentally. Whereas a public health deals with the man in relation to his environment in society outside the workplace, and also where the hazards such as air, water pollution, noise, nutrition, infections may affect his health. When we say public health, which is in a broader concept, where uh, it talks about the overall atmosphere. So I'll take in Delhi as an example. So Delhi, if you see, in air quality level is very poor, especially in the monsoon seasons, or sometimes the Punjab region, the farmers used to burn their crop waste during such seasons or months. The Delhi air quality levels are very poor. That is the overall environment the people are living. That is public health. When we say occupational health, it is specific to your workplace. When we say public health, it talks about the a person or people who are living in a society which is polluted by so many factors. Maybe this pollution would have happened due to the individuals, or sometimes maybe usage of burning of so many fossil fuels, or burning of crop waste, or and also the industrial activities, waste disposal. All these things will cover on this public health. Even water pollution. So we would have seen some of the case. I think last 2 3 years back or 4 years back in Hyderabad, one of the company, they are doing reverse boring. Their industrial waste they are again pumping to the underground by doing a drilling, like doing a bore well. They are pumping it to the underground. Okay, that talks about public health. Okay, I'll just enlarge this image. So if you see workers health or work environment adversely affected by non-occupational hazards, like these are public hazards like air, water, food, clothing, housing, and personal habits and climate. These are non-occupational hazards. అంటే ఇవి మనకి పనితో సంబంధం లేనివి. These are completely no relation with your occupation, which means the activity or the job which you are performing. Those are non-occupational hazards like polluted air, polluted water, polluted or contaminated food, the clothing you're not doing, housing if you're not, if you're not having proper house, or personal habits in the sense bad habits. Then the climate. Okay, then occupational hazards. In the occupational hazards, one is environmental. In the environmental, again we have chemical. In the chemicals we have multiple types of chemicals. So we have another paper which is IS 107, which where we completely discuss about chemical safety. So here it is inflammables like solvents, hydrocarbons, or phosphorus, CS2, or flammable substances, explosives like dust, solvents, vapors, or powder. Then toxic, those are again dust, fumes, gas, vapors, mist, poisons, etc. Corrosives and radioactive. These are the few only. These are not limited to. These are all hazards about chemical in a environment. Then again, okay, I'm stopping till here through the chemical because we have only 10 seconds. After the break, we can continue with the physical hazards in the environment.